Mucha energía. Good afternoon. Welcome, colleagues. Buenas tardes, estimados delegados, invitados especiales. Invitados especiales, buenos días, buenas tardes.
Good afternoon. It's a pleasure to be here today at this session. We would please ask you to find your seats, take your seats so we can kick off this session. I'm Marta Cebolla. I work in the Department of the Elimination of Communicable Diseases in the region of the Americas, 3030. It's an honor for me to be the MC of this very important session. I welcome you to this session titled Accelerating the Elimination of Diseases, Best Buys for Action, organized within the framework of the Elimination Initiative. We do have simultaneous interpretation available in 4 languages. For anyone here in this room, we would please ask you to click the floor button, and then you'll be able to choose the language of your choice. I'm pleased to invite Dr. Jarbas Barbosa, Director of the Pan American Health Organization, to step forward for his opening remarks. Welcome. Thank you, Marta. Good afternoon. Secretary General of the Organization of American States, Ambassador Alberta Ramdeen, Ambassador to the OES, and delegates, PAHO staff, and those listening in to the live broadcast. It's our pleasure.
Accelerating disease elimination by reaching populations in vulnerable conditions. Best buys for action. Organized with the framework of PAHO's Elimination Initiative. I want to express my deepest gratitude to the Honorable Minister of Health of Guyana, Dr. Frank Anthony, the Honorable Minister of Health of Paraguay, Dr. Maria Teresa Baran, and Mr. Stephen Vreden, advisor from the Ministry of Health of Suriname, but I also want to recognize the Honorable Dr. André Misiekeba, Minister of Health of Suriname, who join us today to share their valuable experiences. I think that this will be very important because sometimes we have a PowerPoint presentation and some people, when they are looking, they say, okay, but maybe this is not applicable to my country, or I don't know if this is too ambitious. So the proposal of this technical briefing was inviting countries that are already implementing the elimination initiative. So to share the experiences, what were the challenges, how they overcome the challenges. So I really want to thank you for sharing with us these valuable experiences. I also warmly thank Dr. Robert Matiru, Director of Program at UNITAID. UNITAID is a very important partner for PAHO in the disease elimination, so it's very important to have you with us, Robert. Thank you. The region of the Americas is advancing steadily towards the elimination of communicable diseases. Many countries are adopting integrated approaches that expand the access to prevention, diagnosis, and treatment, and are contributing to the ambitious goal of the Elimination Initiative and improving the lives of millions of people across our region. Our success depends on ensuring that the most impactful, evidence-based, and cost-effective interventions reach the communities who need them most. This entails working to strengthen primary health care, reinforce health information and surveillance systems, and secure strong governance of health at all levels. Ahora voy a continuar en español.
In this session, we'll have the opportunity to hear from countries of the region who have started to apply in their local, according to their local realities, these best buys, best evidence-based implementations based on different diseases. Now, the big challenge that we face is to overcome the barriers for these solutions to actually reach the populations most affected by communicable diseases on a timely basis. And to achieve this, we have to strengthen and coordinate activities for us to sustain high levels of vaccination, to broaden access to diagnostics and treatment, working with communities to strengthen surveillance and to take integrated health services to marginalized communities, those deprived of liberty and precarious settlements. We are aware that these the experiences we're going to hear about today will help to guide countries and partners to adopt them, scale them up, and to work increasingly steadily toward elimination. A couple of years ago, we celebrated the elimination of filariasis, lymphatic filariasis in Brazil, and I'm very pleased and proud to announce another elimination, that is malaria in Suriname, the first country in the Amazon region that has achieved this historic breakthrough. This progress improves health, the quality of lives of the citizens of Suriname, and is an inspiring example for the whole region of the Americas. Join me, please, in congratulating Suriname for that great achievement.
Gracias a todos.
I thank everyone for being with us here today. This is going to be I hope this is a very productive session. And join us as we go down this path of the elimination of diseases in the region of the Americas.
Thank you very much, Dr. Barbosa, for the welcoming remarks. It is a true honor to have Dr. Robert Matiru, Director of Program Division of UNITAID, with us today. UNITAID is providing critical support to countries in the region of the Americas and to PAHO to accelerate the elimination of HIV, mother-to-child transmission of 4 diseases, and cervical cancer. We would like to recognize and thank UNITAID for this strong collaboration and partnership. I am now inviting Dr. Robert Matiru to deliver his remarks.
Thank you very much. Honorable ministers, ambassadors, and country representatives, Dr. Yarbas, and PAHO colleagues and friends, as well as other esteemed partners and collaborators in the room. Thank you for inviting UNITAID to make some opening and framing remarks on this really important technical briefing. I'm representing here our Executive Director, Dr. Philippe Dunton, who couldn't join us, but I'm most grateful that I was able to be here to share this session with you. We at UNITAID, who have partnered with PAHO and PAHO's member states for many years, are most impressed by the Best Buy initiative for disease and condition elimination in this region. And we're impressed because of, one, its ambition. It's an ambitious initiative covering 30 or more Best Buys. We're impressed by its focus and clarity. It's very specific about the diseases and conditions. It's very specific about the goals and targets. And thirdly, we're impressed by the timeliness, the attempt to address and eliminate not only in the long term, but in the near to medium term, because every day, month, and year that counts in that timeline is lives that can be transformed, deaths averted, morbidity reduced. From UNITAID's perspective, I want to highlight 3 key areas, although our collaboration and work spans many of these Best Buys, both in infectious and non-infectious conditions. And the first one is to do with EMTCT, or elimination of vertical transmission. I don't need to remind all of us, but if we talk just about children, every year 5 million are dying before their 5th birthday. And the major driver we know, among others, if we talk about infectious conditions, is HIV, syphilis, Hep B, Chagas, to name just a few. But the one common denominator for all these conditions is that they are all preventable with timely diagnosis and treatment. And that should encourage us. But what we should address is the discouraging fact that not enough is being done. And we know that it affects beyond children, pregnant women, and other vulnerable groups. And that's why elimination efforts in this constellation of conditions, among others, is really, really important. And we're pleased to say that in May this year, we launched a comprehensive program called Safe Start Plus. It's a 4-year initiative fully aligned with the Best Buy initiative of PAHO and almost $30 million in catalytic investment. And the aim here is to scale up uninterrupted family-centered and integrated EVT services. We're focusing on 9 key countries, including Brazil and Paraguay, and also an additional 10 peer learning and influencer countries, including, for example, El Salvador. And why is it a Best Buy? I mean, PAHO has classified rightly Best Buys as cost effectiveness and impact in a timely way. We're focusing on 3 things. Community leadership, because communities are at the forefront of the response. They are the people living with and affected by the conditions who are best placed to support interventions to position these things for scale. But also it focuses on market shaping as well, and generating evidence on the most feasible and impactful ways to deliver interventions. For example, we're going to be rolling out triplex testing that can test in one go HIV, syphilis, and HPV hepatitis B through point of care and new point of care, as well as more established lab platforms. Why is that important? Well, I don't need to tell you, because it's all about translating the talk about integration into reality and leveraging health product innovations as one critical tool towards that integration. Beyond EVT or EMTCT, one really important area is in the area of women's health. And Unitaid is pleased to have been at the forefront of efforts globally since the last 6 years on the second pillar of cervical cancer elimination. We have been the lead multilateral investor in bringing better screening and preventive treatment to women presenting with precancerous lesions. And the innovations that we've supported to introduce around screening, both molecular testing, as well as more traditional testing, as well as treatment, have dropped prices between 40 to 60%. And we've been working with a strategic fund and PAHO member states to translate those prices so that they're available to member states also in this region. Beyond that, the financing is absolutely key, and we're pleased that to date we've invested more than $80 million and are positioned to invest another 50 in the coming 2 years to continue this fight across screening and treatment. We're also looking at novel ways to screen, although they're still exploratory, such as AI and AI-assisted screening. They could be transformational in doing this even more cost-effectively. Lastly, honorable ministers and guests, I want to highlight another critical area. We all know that HIV/AIDS as a major condition has been with us for decades. Up until recently, we had made amazing progress, 40% reduction in AIDS-related deaths, 60% reduction in associated infections. But we know all this is at risk now, given the major defunding that we've seen, and the setbacks could be really astounding. UNAIDS has estimated that we could see an additional 4 million deaths and 6 million AIDS-related infections if we don't address these setbacks to programs. So we were very pleased last week at the UN General Assembly, and this was some of the more positive news coming out of New York, to have announced with President Clinton a massive reduction in the price for lenacapavir as a critical new tool in HIV prevention. 2 injections, almost equivalent to a vaccine per year, giving full protection to vulnerable populations. And that price will be $40 with a generic company in India for the 2 injections per year. And we're aiming with that company to bring that product to market in 2 years, by 2027. And the Gates Foundation, alongside us, announced a similar deal will be upcoming with Hetero in India as well. This will build on other efforts Unitaid is leading on implementation studies. And by that, I don't mean long-term research. I mean practical studies to work with populations on how to assess the feasibility and the impact and the acceptability of this new technology. So it won't help us eliminate HIV tomorrow, but it will certainly set us on a pathway to really bend the needle. But also we hope address the setbacks we've seen to HIV/AIDS programs because of the challenging development financing context we find ourselves in. So I'll conclude there, ladies and gentlemen, and thank you for the opportunity to share some of these concrete examples which are more positive in these negative times on the direction of travel that we can all take together. Thank you.
Thank you very much, Dr. Matiru. We now move to a historic moment, the celebration of the elimination of malaria in Suriname, the first Amazonian country to reach this important goal. To open this part of the program, let us first watch a short video highlighting Suriname's path to malaria elimination. It seems that we have technical issues. Okay, we can wait for the video, and now I'm seeing the video there. Okay, there you go.
Our success has been through governments and the dedication and commitment of our health workers and our policy makers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho.
People who are willing to do the work with motivation to work with the community itself. That's what we did to reach our objective.
I would like really these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
To reflect on this important achievement, I have the honor to invite Dr. Sylvain Aldiguieri, Director of the Communicable Diseases Prevention, Control and Elimination Department at the Pan American Health Organization, to deliver his remarks.
Thank you, Dr. Saboya. Honorable Minister of Health of Suriname, Excellency Ambassador of Suriname to the Organization of American States, distinguished delegate from the Malaria Task Force in Suriname, Excellency Secretary General of the Organization of the American States, PAO Director Dr. Barbosa, distinguished delegates, colleagues and friends, I'm really honored to give the introductory remarks in celebration of Suriname being declared free of malaria. Suriname, as our director said, is the first country of the Amazon basin to have successfully eliminated malaria. This is a very important milestone in the history of the fight against malaria in the Americas. Suriname's achievement demonstrates that it is possible to eliminate this disease within the difficult context and ecosystems of the Amazon region, where the affected populations are dispersed, including Amerindian communities, and in the case of Suriname, the maroon population, and where gold mining has been the main driver of malaria for decades. Around the year 2000, Suriname reported approximately 15,000 cases of malaria per year. During these years, it was the country in the Americas with the highest number of cases relative to its population. Suriname eliminated malaria when it decided to focus its efforts on making diagnostics and treatment available to communities through community health workers and volunteer networks, especially in rural and sylvatic areas. Suriname has now successfully covered the last mile toward malaria elimination, leading the way for the other countries of the Guyanese Shield. Suriname experience is an example of smart decisions, technical knowledge, pragmatism, innovation, and policy continuity. We must recognize the sustained efforts of the Ministry of Health, beginning with Minister Celsius Waterberg, and the actions of experts such as Dr. Stephen Vreden, present here today, and Dr. Martelise Hersel, who we have seen in the video, who for years have served on the task force that was created specifically to eliminate malaria. We must also acknowledge the work of the medical mission, the Bureau of Public Health, BOG, and all community health workers who have dedicated decades of work under the challenging conditions of the hinterland. Congratulations to the people of Suriname. Thank you.
Thank you, Dr. Algieri. Now we are going to recognize Suriname, and it's my honor to invite Dr. Jarbas Barbosa, Director of PAHO, to get together on the stage with Honorable Secretary General of the Organization of American States, Mr. Albert Ramden, and Honorable Dr. Andre Misiakaba, Minister of Health, Welfare and Labor of Suriname, to receive the certificate. Please join us on the stage.
Probably you need to have an extra language. Going back home, but it's really a very important one. I think that this will be in a very good place at the Ministry of Health, because it will remind all of us that it's possible to eliminate malaria as you are proving this in your country. And here you have a letter to the President of the country, a letter from WTO, and a letter from PAHO.
Thank you very much. Now, it is my honor to give the floor to the Honorable Dr. Andre Misiakaba, Minister of Health, Welfare and Labor of Suriname, for his remarks.
Thank you. All protocol observed. On behalf of the government of Suriname, I wish to express our appreciation to PAHO and WHO for formally acknowledging the elimination of malaria from our territory. This milestone is not only important for Suriname, but also for the Amazon region, while observing the downward trends in malaria transmission, hopes are that in the near future, malaria elimination will be reached across the continent. Supported by several international partners, among which PAHO, WHO, USAID, we have been working for decades on the control of malaria in Suriname. In the year 2002, Suriname had the highest annual parasite index for P. falciparum on the continent. I myself contracted malaria in this period. I almost died. We believe that expanding access to diagnosis and treatment, together with bed net distribution and community involvement, have been crucial in achieving control and eventually elimination of malaria. In the year 2018, due to the steady decline of malaria cases in the country, we became convinced that malaria elimination was feasible. In that same year, a malaria elimination task force was installed with a specific task to guide activities towards elimination. Post-elimination, we do realize, however, that especially with our open natural borders and intense migration, mainly fueled by small-scale gold mining, our status of malaria elimination is still very vulnerable. I will repeat this. Post-elimination, we do realize, however, that especially with our open natural borders and intense migration, mainly fueled by small-scale gold mining, our status of malaria elimination is still very vulnerable. Only when transnational efforts to eliminate malaria from the Amazon region are coordinated, the achievement of Suriname can be sustained. We therefore applaud PAHO's initiative to continuously support the efforts in the region. The Ministry of Health, Welfare and Labor is also aware of PAHO's initiative for the elimination of diseases. This is considered as a powerful action which is welcomed and fully supported by the government and the Ministry of Health, Welfare and Labor in Suriname. Let us celebrate Suriname's achievement today, but also persist in working on improvement of malaria control and ultimately elimination from the whole Amazon region. The government of Suriname herewith expresses its commitment to permanently support these transnational efforts. I thank you very much.
Thank you, Dr. Misiakawa. Ahora nos vamos a mover a la siguiente.
Let us move now to the next part of this session. We will be presenting to you the best buys, and these have actually been mentioned quite frequently at this session. It is my pleasure then to explain to you what these best buys are. You have probably seen them this week in what is presented outside of the room in the hall. This year, the Pan American Health Organization launched what we have called Best Buys to Eliminate Diseases, and we launched them for the reason that you see on this slide. The region of the Americas has successfully eliminated diseases. We have 51 countries and member states. In dark green, you can see the number of countries that were able to eliminate some diseases, in particular those that are vaccine preventable. Urban transmission of yellow fever by Aedes aegypti, among others. However, you can see that there are some bars that are in pale green. Those are diseases, and the number of countries that are very, very close to elimination. Hepatitis B from mother-to-child transmission. Dr. Matiru mentioned it. We have the tool for it. dog-transmitted human rabies. More than 35 countries have spent years without having any case of human rabies and are very close, perhaps, to reaching elimination. Yours, we believe, is another disease, or open-air defecation, where countries have invested so much to increase access to water and sanitation. However, there is another group of diseases where there are many countries that need to accelerate their efforts for elimination. Bacterial meningitis is one example. Some countries still need to move forward to eliminate malaria, as Suriname and 19 other countries in the Americas have already done. There are communicable tropical and neglected diseases where, here again, it's necessary to accelerate. Leprosy, filariasis. There are still too many people for these diseases for which we have treatment. And at the bottom of the slide, you see many countries where we still need to accelerate eliminations of such as cervical cancer, tuberculosis, viral hepatitis, in particular B and C. These are diseases where today we do have tools. The HIV/AIDS and sexually transmitted infections such as gonorrhea and syphilis, and mother-to-son child transmission of syphilis. It is for these, we're convinced that if the countries, donors and partners were to invest in the best cost-effective interventions that exist today, that we have proved by evidence that it works, then we'd be able to change the panorama rapidly with more local strength. That is why we have launched the Best Buys, and you're seeing an example here on the screen for leprosy in this case. These are concrete tools that allow us to know what to do, where to invest the available resources, and how to better use the scant resources available. To explain a little bit more, let's move on to tuberculosis. In this example, we show which is the target. It's very difficult for all of us here to know the target for 34 diseases. So what is the target? What do we have to achieve prior to elimination in order to get closer to it? And in the middle of the slide, what is the package of programmatic targets that we need to invest in to achieve it? If we can implement these Best Buys, we know it is possible to accelerate the goals for elimination, and therefore we invite you to consult them, to use them, and the technical cooperation of PAHO is available to you so that these Best Buys may be implemented in your countries. This is the QR code to the webpage where you will find the 34 Best Buys. They are available in the 4 languages. And without further ado, let us now see how countries are implementing these Best Buys in the Americas. Before that, we'd like to show you a video that shows the situation, for instance, in Brazil, how they're implementing actions in HIV disease. And this is one of the diseases with a target for elimination for public health in the region. Here you have the video.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia.
É preciso que essa abordagem ela seja integral. Apenas a disponibilização de testes rápidos, point of care, e mesmo somente o tratamento, ele não é capaz de resolver a situação de vulnerabilidade que essa população ela se encontra. Está muito associado com o estigma, o preconceito, a fome, a miséria e a falta de acesso a serviços de saúde, levando a um desfecho desigual entre as populações.
E a gente ter um método diagnóstico rápido para fazer ter certeza do que a gente está tratando faz muita diferença.
A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa. Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS, e eu chego até a me emocionar para falar deles, mas que de fato é uma equipe que faz muita diferença assim, no trabalho aqui em Porto Alegre e que tem muita vontade de mudar as condições materiais de vida das pessoas.
A continuación daré.
Let us now move to the panel to hear about national experiences and learn how countries in the region are implementing these best buys in their countries. Dr. Monica Alonso, head of the HIV, hepatitis, tuberculosis and STI unit of Pan American Health Organization. She will be supported by Dr. Frank Anthony, Minister of Health of Guyana, Honorable Dr. Maria Teresa Baran, Minister of Health of Paraguay, Dr. Stephen Vreden, Advisor, Ministry of Health of Suriname. They will share with us their experiences. We invite you to please join us here at the head table. Dr. Monica, let me hand over to you as moderator. Thank you very much. Marta.
Honorable ministers, delegations, director, assistant director, deputy director, colleagues, and friends. It is a pleasure to moderate this panel in which we're going to listen to distinguished leaders of countries in our region explain to us how they have implemented the best buys in areas of viral hepatitis C, in areas of HIV, TB, STIs, and viral hepatitis in context of prisons, and also how they have implemented the efforts for malaria elimination. So without further ado, I remind you we will have 2 questions per each panelist. We request that you be succinct and limit the responses to 3 minutes for each question. We will start with a first round, and then we will continue with a second round of questions. So first, Dr. Frank Anthony, let me start with you. What have been the most impactful interventions in Guyana for the elimination of hepatitis C, and what were the most successful factors that made that progress possible?
So thank you very much for your question. Hep C has been a problem in Guyana. We detected that because through our blood transfusion process, we've been able to identify persons who come to donate blood, and we were able to detect that some of them had Hep C. But we were not able to do anything about it because we didn't have access to medication. And we tried to work with some of the pharmaceutical companies, but at the time, the cost of medication, the cost of treatment for a patient would have been close to $2,000 per patient. So in 2022, I think when I came here, one of the things that I saw was that through the strategic fund that countries were able to access Hep C medication. So that was one of my takeaways when I came to the Directing Council meeting, and I decided that we want to implement this in Guyana. So because we now have access to medication, we went back, we were able to set up our program, and through that program, we were able to access both the testing and medication through the PAHO Strategic Fund. And just for context, when we were trying to do it with the pharmaceutical companies, we were going to get $2,000 per patient. And through the strategic fund, we were able to access it at less than $100 per patient. So I think that's really a best buy. And that's why, for us, we thought it was a no-brainer. We came through the strategic fund. And we have been implementing this since 2022. We have 192 patients, and the cure rate is about 92 to 95%. So we are quite happy with this intervention.
Thank you, Dr. Anthony. Definitely a best buy at those prices, and also with the success rate that you're mentioning for viral hepatitis C, which previously was an illness that we didn't have cure for, and of course that causes not only cirrhosis, but also cancer of the liver. Ahora vamos a pasar a Paraguay.
Let us move to Paraguay now. Dr. Baran, what elements were key to implement the package of integral services such as HIV, tuberculosis, hepatitis in the context of penitentiaries in Paraguay? Thank you very much for that question, Monica. It's an honor to participate at this session that celebrates the elimination of diseases by reaching out to populations of vulnerability. In Paraguay, we have a specific problem at our penitentiaries. We have 20 establishments with some 19,000 people deprived of their freedom, incarcerated. Here, approximately 20% of the national tuberculosis burden is concentrated. In other words, 900 out of the 4,500 cases that we report annually. Our genomic studies show that approximately 30% of tuberculosis in the community are directly tied to prisons. This means that 50% of the TB tuberculosis in the country is related to prisons. That is why we strategically emphasized controlling TB in these places, understanding that prisons are the driver of the epidemic in Paraguay. To control TB at prisons is not exclusively the work of the tuberculosis program. The increase in cases is not only a health challenge, but furthermore, it reflects conditions of social and structural vulnerability that require intersectoral interventions on their determinants. Currently, the National Tuberculosis Program, in coordination with the Penitentiary Health Department at the Ministry of Justice, work in a coordinated fashion with the National Program to Control AIDS, with HIV, STI, hepatitis services, through systematic screening when the prisoners arrive and then remain in the penitentiaries. Then we have the expanded immunization program that guarantees systematic vaccination against Hep B, tetanus, diphtheria, flu, and COVID, together with screenings for diabetes and mental health in accordance with the risk profile presented by each individual. Today, we have two new prisons, Niguazu and Boscada, where we are applying a model with universal screening for all new arriving prisoners, latent TB stud through IGRA and preventive therapy for latent disease. The model seeks for these penitentiaries to become spaces with values close to TB elimination. Another key component has been having health promoters work within the penitentiaries, people deprived of their freedom but trained and committed to health in their sectors, as well as training and care of the personnel at the penitentiary, strengthening the response capacity of the system. The Ministry of Health is convinced that maintaining a healthy prison means also protect health of the general population. Thank you very much. We thank you for your comments.
Muchas gracias, doctora Baran.
Dr. Baran, thank you. You were extremely clear, and the data that you shared with us show that to take care of health in prisons is care focusing on public health of the entire community. Let us now move to Dr. Stephen Vreden.
Lessons can other countries learn from Suriname's experience in training and equipping local community members, especially in those hard-to-reach areas, to lead malaria elimination efforts?
Thank you for that question. Well, there are several lessons to learn because malaria management, malaria diagnosis and treatment needed to be available in two quite different settings. One is the stable communities in the interior. In those communities, we have an organization called Medical Mission that has been providing care to people living in the interior, indigenous people, maroon people. And this is an organization that has been there for 60 years. What we've been doing with regard to malaria is making sure that in every village, in every hamlet, there was malaria diagnosis and treatment available. Initially, that was before rapid tests were used. We had to do it with microscopy. But we saw that microscopy, it takes time, and it also takes quite a lot of people who are experienced in doing microscopy. So in the year 2003 already, we started testing rapid tests to see what their quality was. And as soon as there was a rapid test of an adequate quality, we implemented rapid tests because that made a big difference. We continued doing malaria microscopy because we knew that you need to confirm your diagnosis with microscopy, but for more than 90% of the people, malaria diagnosis could be done in 10 or 20 minutes. So that is one of the most important things that we did in the stable communities. In the mobile and migrant populations, which are, as the Minister said, mostly related to small-scale gold mining, this was completely different because those mining situations are not very safe. So you could not deploy your staff there, especially since we think that malaria diagnosis should be available 7 times 24 hours. So we started recruiting people from the community who were there on their own risk because they were working in the gold mining community. And we trained them in doing malaria diagnosis and also in doing giving the treatment. And these were people who were sometimes shopkeepers, sometimes cooks, but people who were available and who had a certain level of intelligence so you could easily train them. So that worked well. And gradually we could even involve these people in surveillance because you can do a diagnosis, but you need to know also how much malaria there is. And I must say with mobile phones, it's easy to have real-time communication with these people. And I think that was something that really changed the pattern of malaria in the mining fields. As a small example, I can tell you that in the year 2023, because we have no local transmission of malaria, but there are still quite some imported cases. In the year 2023, more than 30% of the malaria cases diagnosed in Suriname were diagnosed by these people in the mining fields. And if these cases had not been diagnosed immediately, we would have never reached malaria elimination. So I think this says enough about the effect of involving the communities in helping you get rid of diseases. Thank you.
Thank you very much. Impressive. Very impressive. This is definitely public health in action, and definitely we see the best buys and how they're implemented, right? Because it's not only having the rapid tests, but how you involve the community in order to amplify its effects. So thank you, Dr. Freden. Now we will continue back to Guyana. Back to viral hepatitis C elimination. And of course, in the implementation with that very successful treatment, what are the challenges that Guyana is facing in expanding hepatitis C services, and how are you addressing these challenges?
So we have several challenges. I think Guyana is a fairly large country. We have 10 regions. And this program, we started it in Georgetown, which is where we have the capital. We have now been able to roll it out to about 5 regions. And so we need to go to the other 5 regions to make sure that people can access these types of treatment. Because of that too, we've seen a variance of prevalence. So in the regions where we're doing more testing, obviously we're seeing cases. So that's something that we hope by taking it out to the other regions, we'll probably see an increase in cases out there, because so far they have been underserved. So that's one of the things that we're doing. The other thing that I think we need to strengthen is to, while we have developed guidelines, is to make sure that all our physicians, especially those in primary care, would be able to do this on their own. We have about 450 primary care units in different locations. So if we train primary care physicians and the physician assistants, we think that we'll be able to rapidly expand this. So that's something that we're working on. We have finished the guidelines. Now it's rolling out the guidelines and making that implementable across the system. We also have to tighten our accessing meds and distributing it. We do have some challenges with that, so we're strengthening on that front as well. One of the things that we're implementing is to put in an electronic system for monitoring medication. And so by the end of this year, early next year, first quarter of next year, that system should be up and running so that we will be able to trace, as we buy things and bring them into the central material management unit, until it goes out to the patient, we'll be able to monitor that. So that would complement what we're doing. We're also implementing electronic health records, so we'll be able to see and follow up with patients. And despite wherever they go in the system, we'll be able to identify them and work with them. So I think we still have some challenges, although we see this program as a very positive program. Being able to offer treatment that wasn't there before, we now need to make sure that it's rolled out across Guyana, and that's what we're endeavoring to do now. Thank you.
Thank you. Thank you very much. Yes, many times we encounter that patients with viral hepatitis are mostly hidden, so there has to be a lot of testing to find those patients, and of course the awareness and the capacity building of those health providers to actually test and be aware. So, and that coupled with the electronic medical records and information systems, I'm sure that's going to make the program very, very successful. Dr.
Maria-Teresa Barran, how has the use of technologies and innovations such as the portable X-ray machine and artificial intelligence, how have those devices helped you close the gap in diagnosis and treatment of certain infectious diseases, hepatitis, HPV? You've referred to them as far as vaccines are concerned. What can you tell us? Well, for Paraguay has been a pioneer in the region by introducing AI-assisted radiology and for screening for tuberculosis and prisons, the main advantage is that it doesn't require for a specialized radiologist to be there to interpret the images. This has enabled us to be quicker and more nimble in our diagnosis in an environment where we don't have much staff for that purpose. Now, also, that has made it possible for us to achieve early detection of those even with minimal symptoms so that we can optimize the interpretation and also we can use bacteriology to double-check the suspicious cases that have been tagged by our AI-assisted X-rays. Now, this enables us to shorten the chain of transmission and to protect the whole prison population through early detection. We hope that after this initial rise in detection, thanks to AI, we hope that in upcoming months, we will sustain a drop of TB in prisons. This experience confirms that technological innovation, working with vulnerable populations, can be quite advantageous and successful in our move toward the elimination of some infectious diseases. Thank you. Yes, in fact, more than half of the cases that are being detected by X-ray assisted by AI don't actually have any symptoms or outward signs, so it is indeed a very cost-effective means of diagnosing after the initial investment, but in the long run, it does optimize the tests that you were.
And we would want to know, Dr. Vreden, what lessons can other countries learn from Suriname's experience in training and equipping local community members? I think in local community members, especially in hard-to-reach areas, to lead malaria elimination efforts.
Yes. I think that one of the things that we need to realize is that there is a lot of illegality going on in mining. Law enforcement and health don't go together. So you really must focus on health without looking at whether someone is legal, illegal, criminal, or whatever. Otherwise, you will lose one of those battles. If you want to win the battle of health, don't get involved with the battle of law enforcement. That is one of the, because if we, especially when we came into the phase of pre-elimination, it's very important to have a very detailed case investigation. You need a travel history, and the people must trust you to tell you their travel history. So it is the people involved must be sure that you're a health worker and not a law enforcement person. That is something that we learned, and there is enough trust now in the mining field. So this is something that people need to realize. And also, we were training people recruited from the mining community. And you want to keep these people working for you for quite a long time. And they get a stipend, but that is not interesting because you cannot compete with payments in gold mining because these are enormous. What we do is every time when we train these people, we provide them with a certificate of malaria management. And I was surprised to see how these people value this certificate, because for most of them, it's the first certificate, the only certificate they ever had in their lives. So it makes them proud, it makes them feel that they really can mean something to their community. And this goes as far as that now we hardly have any malaria, but you want to keep these people motivated. So we also train them in doing blood pressure measurements, because that's also an epidemic in the gold mines, in diabetes management, in HIV testing, in viral hepatitis. So you can gradually expand their work to keep them motivated to do malaria, but also do other things that are very relevant to the community. So I think that these people, although they started as malaria service deliverers, you can also use them in providing more healthcare to the community that they're part of. I think that's about it.
That's fantastic. I was actually not expecting to hear also this lesson learned in integration. So I don't know if my microphone is on. I think it can be heard, because this is also a wonderful lesson for integration of several diseases in one response. Thank you very much for that. Well, I think we are on time for some questions and answers. I don't know. I'm looking to find there Marta Saboya, that was going to help manage the question and answer session.
Monica. Thank you, Monica. And panelists, please stay there. So we have now some minutes to take comments or questions for our esteemed panelists, if any. Ambassador Celine, please.
Merci beaucoup. Je peux parler en français, n'est-ce pas?
Thank you very much. Director General, ministers, ambassadors, and dear colleagues. First of all, I'd like to congratulate Suriname for the certification it has obtained. Wonderful success, and that will be good for health throughout the region, including us as your neighbors. Let me also thank the speakers for the quality of their words and the interesting subjects they raised today. France, PAHO, voted in favor of the resolution to eliminate 30 diseases by 2030, and we'd like to reiterate our support for this elimination and our commitment to continue working in providing support for these matters of importance to our people. And also in Guadeloupe, Martinique, and French Guyana, we want to achieve similar results. Our universities in Guyana and other countries play an important role, as well as the Pasteur Institutes throughout the region. Today, as we congratulate Suriname for elimination of malaria, I'd like to recall and insist on the importance of reinforcing cooperation regionally to eliminate malaria in the countries close to French Guyana and Suriname. Elimination of malaria is a key for the human and social development of our countries that share similar ecosystems, the same challenges to access health services in people in remote areas, and the challenge posed by migration. France is committed to eliminate malaria in French Guyana by 2030. Our regional agency for health actively participates in the Guyana Institute to eliminate malaria and other centers that are working. We will continue sharing our scientific expertise and make it available to the countries of this Amazonian basin region. Thank you very much.
Très bonne nouvelle.
That's wonderful news.
A few other questions. We're actually, I've heard very well with the time. So I think there's a question over there or comment.
Thank you very much, Philip Telesford Grenada. I welcome Suriname to malaria-free status. I think it's a wonderful achievement, and I commend you and your government for the hard work that and the tactical approach that you have adopted to acquire that status. I recognize that you have an open border country, and that would, of course, render you very vulnerable as far as malaria is concerned, and the fact that you mentioned migration, people migrating to a country for the purposes of mining, and that in itself will be a challenge. You also mentioned that health and law enforcement does not go hand in hand in the context that you must maintain a level of confidentiality with your patients. But my question to you is, how do you preserve that against the obligation to report and to ensure the security from a national security perspective as a government? How do you embrace national security, ensure that because malaria, gold mining is one aspect, only one aspect of business. There could be other criminal activities that could become a real threat to national security. In your fight against malaria and other diseases, how do you preserve the confidentiality of your patients in that context against another threat, the threat of criminal activities happening within your borders? Thank you.
Ok, gracias. Vamos a tomar un par de...
Thank you. Let's take a few more questions and comments.
Nolan from the Carter Center, take the floor.
Thank you, Madam Chair. Honorable ministers, distinguished guests, delegates. My name is Greg Noland. I'm the director of the malaria, onchocerciasis, lymphatic filariasis, and schistosomiasis programs at the Carter Center. So I first bring you greetings on behalf of the leadership of the Carter Center on today, October 1st, would be President Carter's 101st birthday. The Carter Center, well, first, congratulations to Suriname. You have shown us what is possible. You have also shown us what is needed in the fight against malaria to focus on communities, particularly affected communities, with community-based approaches. So thank you and congratulations. The Carter Center is a WHO non-state actor, and so I have been invited to provide just very brief comments from the non-state actor perspective on efforts to eliminate among vulnerable populations. NTDs frequently affect the most neglected and vulnerable populations, as we all know, and I appreciate the opportunity to highlight a few best buys. We all know that elimination is always a best buy because it allows program resources to be reallocated for other initiatives once success is achieved. Since 1996, the Carter Center has worked with PAHO and National Ministries of Health to eliminate onchocerciasis from the Americas region. This effort was first guided by the 1991 CD35R14 resolution, calling for elimination of blinding morbidity associated with onchocerciasis, and the later 2008 CD48R12 resolution. Since that time, 4 countries, Colombia, Ecuador, Mexico, Guatemala, have achieved WHO verification of transmission elimination of onchocerciasis, resulting in a 93% reduction in the at-risk population in the region. However, a small population of around 40,000 people remain at risk. That is the Yanomami people and other indigenous peoples deep in the Amazon jungle along the cross-border region between Brazil and Venezuela. This population is also threatened by illegal mining, as has already been mentioned, by deforestation and other encroachments that bring violence and disease from the outside world. In partnership with PAHO, the Carter Center supports Ministries of Health teams by boat, helicopter, and fixed-wing aircraft to provide interventions to interrupt onchocerciasis. But traveling all that way to only deliver one intervention would be a big missed opportunity. And so we just heard the importance of integration. And so we need to think beyond our siloed thinking And the program now embraces a more than Mectizan approach to also deliver immunizations, rapid testing, and treatment for malaria amongst the Yanomami populations. We are confident this integrated approach will help achieve the specific goal of eliminating onchocerciasis from the Yanomami focus area, thereby creating an entire Americas region free of this blinding disease. But vulnerable populations aren't limited only to remote jungle locations. On the island of Hispaniola, the urban residents of Port-au-Prince, Haiti, suffer indiscriminate violence, while those living in the countryside suffer from the atrophy of health services. Similarly, on the other side of the border, migrant farm workers in rural areas of the Dominican Republic also face challenges accessing health services. Each of these contexts presents a unique threat to public health, especially in efforts to eliminate neglected tropical diseases and malaria. In conclusion, it is often said there are no neglected diseases, only neglected people. So I applaud this session's focus on vulnerable populations. The Carter Center appreciates the longstanding partnership with PAHO to jointly support ministries of health in their efforts to create a healthier Americas region under the Elimination Initiative framework. Thank you very much.
I think we can pass to the responses. Dr. Vreden, would you like to take the mic to respond to Minister of Guyana, and then?
Oh, yes. Thank you for your question. My primary profession is I'm a specialist in internal medicine. And I have been working at the academic hospital in Paramaribo. And I have been consulted quite often with people who are in the legal system. They often came directly from prisons to see us in the hospital because for some ailments. One thing that one of my ancient teachers taught me, it's better not to know why someone is in your office, because it might influence your attitude towards this person. So I never asked, I didn't want to know. But doctors, yes, we are trained to just provide healthcare and not to do other things, to report people. It's even against the law to do that. And it's important because you're working with people who don't have a formal medical training, but it's important to explain this to them, that you're here working for the health system and every other thing is for another department. And especially if you are not focusing on what you need to do, you will not reach what you want to reach. So it's something about training and about consequently saying, we are here not for law enforcement, we're here for health profession. And it's doable, and people understand also because they see that you gain trust. If someone thinks that you're related to police or whatever, he will never tell you about his whereabouts. And that's what you need to know if you want to get rid of malaria. I hope this answers your question to some extent.
Thank you. We are going to now pass the floor to Dr. Anthony.
Thank you very much. First of all, let me thank France for the intervention. I know many years ago we did have very good relationship with Institut Pasteur, and we did a lot of good research work. So I look forward probably for us to resuscitate those links, because I think we have common problems that we can address together. In terms of the Carter Center, we have done work with you more on the area of democracy, and we haven't done so much work in health. But I think expanding to health would also be very useful, because I'm sure there are areas in which we can partner with you. One of the things that have been very successful for us is that we have been collaborating with the countries around us. We have very good collaboration with Brazil, and in fact we do cross-border vaccination. Just earlier this year I was on the neighboring town in Brazil that borders with Guyana. And we had very good response because our medical team would go across, their medical team would interact with us, and whatever the issues are across the border, we try to address them. We also had, I would say had, a commission between ourselves and Suriname, a health commission. And from time to time it works and then it goes dormant. So that's something perhaps that we need to pick up because we can discuss these matters that affect both countries and we can fix them. With Venezuela, we actually do see a lot of patients from Venezuela that come and access service in Guyana. And we provide that service just like we provide for any other Guyanese citizen. And in cases where they need to be medevaced, we medevac them to our central hospital and provide care for them. So that's something that we have been doing, and I think that has worked very well because we know in cases of infectious diseases, you can't vaccinate on one side and expect that the other side would be okay. So we have been doing that, and I think that has been really working for us. Our elimination agenda goes beyond Hep C, and we have been working on other diseases. For cervical cancer, we have partnered with PAHO, and that's another best buy that I think countries should buy into. PAHO has recently signed an agreement, I think, with Merck, and now you can access Gardasil 9 for about $15 US. Compare that to in the US, I think it's $360 US per dose. That's a good buy as well. We have recently switched, and we are now using Gardasil 9, which is more protective for HPV. We've also introduced HPV screening, so that's something that we've been working on. But HPV is on our agenda. We have been working along with PAHO for a number of years in terms of filaria elimination, and we are on target. We believe that before 2030, we'll be able to eliminate that as well. Malaria has also been on our agenda, and similar things to what Suriname did and continues to do, we have been doing that. Malaria is now endemic in 4 of our 10 administrative regions, and by continuing to push some of these programs, we are confident that before 2030, we'll actually be able to eliminate malaria. We have also been working on leishmaniasis, Chagas, and a number of other leprosy, TB, PMTCT. So there are lots of programs, and I think we have demonstrated good success. But as these programs mature, we'll be able to see those results. But we'll be making quite a lot of investments, and I can say that we have counted a lot on PAHO for the technical assistance, and in some cases where medication has been available, we try to get that and access that through the strategic fund. I would want to, as a country, we have benefited tremendously through this relationship. It puzzles me, though, that many other countries that have similar challenges are not utilizing, maybe they don't know the options that are available, but certainly not utilizing the opportunities that presents itself through the revolving fund and the strategic fund. So perhaps it's something that countries should think about, because I'm speaking from personal experience where we have benefited. And if we can benefit, I'm sure PAHO want to share this benefit with everyone. So don't be shy. Maybe you need to approach them and talk to them some more. Thank you.
Thank you. Thank you, Dr. Anthony. Would you like, or está bien? ¿Quiere decir algo? Estamos bien. Yes, before we close, there's several items I would want to highlight from our speakers, and maybe we could start with the strategic fund. As Dr. Anthony was mentioning, he mentioned several examples. We have a long list of not only medicines, but also diagnostics, but also equipment, as Dr. Baran was mentioning about the portable X-ray machines with artificial intelligence. That also is available through the Strategic Fund. So the Strategic Fund is fully aligned with the Elimination Initiative in support of the Elimination Initiative and offers not only these supplies and diagnostics and medicines at affordable prices, but alongside technical cooperation to collaborate with you in where to place them, how to implement, etc. Also, besides the clear cost effectiveness of these best buys that we're seeing, we saw the governance, right? The leadership that is first and foremost needed to actually move ahead to implement the best buys and accelerate the progress towards elimination, and that the work with the other community members, which is essential. In addition, I would want to thank the Carter Center for their support and their collaboration through these years in the elimination of onchocerciasis and also malaria. Very, very close partner to PAHO. And also the government of France for their commitment to support malaria elimination in the Guyanese Shield. So I just have to mention that really the Elimination Initiative is very ambitious, but that we have been doing it, we are doing it. We have multiple examples of malaria, EMTCT for HIV and congenital syphilis, lymphatic filariasis, onchocerciasis. So we just have to accelerate for all those other countries that Marta was showing that are still in red or orange, but we have the tools, these best buys, to accelerate in, the elimination. So with all the member states, the partner countries, the other partners, the civil society as well, all of us together, we could achieve elimination by 2030. So thank you very much for attending. We will pass on to the next session, the next component.
Thank you. Thank you to our esteemed panelists. We invite all of you to take your seats. And with this great panel, it is my honor to invite Dr. Rhonda Seeley-Thomas, Assistant Director of PAHO, for the closing remarks.
Thank you, Marta. Distinguished delegates, esteemed colleagues and partners, I'd like to sincerely thank all of you for your participation and engagement as we conclude this important session. Today, we have heard powerful interventions from Guyana, Paraguay, and Suriname. Dr. Anthony, Dr. Baran, and Dr. Vreden, thank you for demonstrating that with commitment, innovation, and collaboration, disease elimination is not just possible, it's actually happening right now. We also had the privilege of listening to Robert Matiru, Director of Programs of Unit Aid, who reminded us of the significance of global partnerships in accelerating access to the tools and solutions that make the disease elimination a reality. One of the most inspiring moments today was recognizing Suriname for achieving malaria elimination. This public health milestone, the first of its kind in the Amazon basin, is a testament to what can be achieved with solid determination, sustained investment, and community engagement. It also sends a strong signal of hope to other countries still facing this disease. The discussions today reaffirmed that the region of the Americas has effective best buys at hand that are evidence-based, cost-effective interventions that work. Our collective challenge now is to ensure that these solutions are scaled up, integrated into primary health care, and delivered to the populations that need them the most, especially those living in conditions of vulnerability. Let me emphasize that the Pan American Health Organization remains fully committed to supporting member states in this journey. Working together, hand in hand, we can accelerate progress, protect the gains we have achieved, and move closer to a future where no one in the Americas suffers from diseases that can and should be eliminated. Finally, I'd like to thank Dr. Aldejeri, Marta Alonso, and Monica Soboya and his team, the team from the CD department, for organizing and orchestrating this session. Thanks once again to all of you for your commitment and partnership. Thank you.
Thank you, Dr. Silly Thomas, and we wish you the best in the rest of the afternoon. Thank you very much.
Si no salgo antes de las 6, la lluvia nos atrapa. Aquí siempre nos adelantamos al amanecer, a la lancha que se va sin ti y también a la enfermedad. Antes, registrar las vacunas era escribir en papeles que se mojaban o perdían. Ahora, con el aplicativo, todo cambió. Ya no me preocupo si hay internet, guardo todo aquí y cuando hay señal, sube solo. Las vacunas salvan vidas, por eso nos adelantamos, para que no vuelva lo que antes nos quitó tanto. Sabemos quién necesita qué vacuna, incluso aquí en la frontera. Ya nadie nos gana, nosotros le ganamos a las enfermedades. Ahora los datos llegan a Lima y nosotros llegamos primero.
Hola, buenas tardes.
Con la digitalización de los datos, mejoramos la calidad del proceso de vacunación y aseguramos tener información oportuna para tomar decisiones. La OPS y el Ministerio de Salud del Perú, con el apoyo de la cooperación alemana implementada por GIZ, estamos trabajando para cortar las distancias con tecnología, usando herramientas basadas en las Smart Guidelines de la OMS y fortaleciendo el personal que hace posible la vacunación. Nuestro compromiso es claro: seguir trabajando con el país y sus aliados para cerrar brechas tecnológicas y asegurar que todas las comunidades, sin importar dónde estén, accedan a servicios de salud esenciales. Continuamos en el camino para lograr la salud para todos.